Now, looking at this particular question, trust me, automatically you are feeling, oh, this is a difficult question. I need to start figuring out what the ECG is all about. In reality, Nclex test concept. Before you get terrified with your question, focus on the concept. That's why instead of understanding most thing about the question, most time when I look at a certain question, I focus on what the concept, so that it directs me to the likely answer. Now pay attention to this question, because I know you are paying attention to a lot of things right now. Look at this question. They say the emergency room nurse is caring for clients who report palpitation when assessing the client telemetry strip. Now the nurse notes a fast rhyme with narrow QRS complex as shown in the figure below. Which action should the nurse do first? Now look at the concept. Which action should the nurse do first? Now the only complaint they give to us right here, I always used to tell people, now when the Nclex is telling you first, what the Nclex is trying to tell you is that it seems we are doing a certain kind of procedure, and we need to think about the first thing to do before carrying out that procedure, or we are thinking about nursing process. And when it's nursing process, what are we thinking about? Assessment, diagnosis, your planning, intervention, and evaluation. Right now, that is for nursing process. The first aspect is maybe it's a procedure. Maybe they're asking you're about to insert a urinary catheter. What should you do first? You need to perform under hygiene, gather equipment, and all that kind of stuff. Now that's what the Nclex is all about. When they tell you first, or maybe you are trying to maybe a patient is having life-threatening situation, we are not thinking of what can we do first to save this patient before we do any other thing, right? Those are the three things when the Nclex use this keyword first. So this question is a whole lot of information, but the biggest concept right here is this statement first. The Nclex want to know, do you know what to do first in a situation? Now positioning this question, this is not a life-threatening situation. The client who is reporting palpitation, that is the only situation they give to us. I'm not seeing any life-threatening situation. So based on what I will do first, I want to see if there's any life-threatening situation. So the likely answer I will be looking for in this question will be assessment. And guess what? I've not even tried to figure out what the ECG is all about. But I have an idea what the answer will look like because of the concept behind Nclex writing question. Because I understand the concept behind Nclex question, I know the likely answer the examiner wants from me. Now, palpitation, look at this ECG. Now, all right, this ECG is SVT, yeah, SVT. But with this SVT, this is only what the patient is experiencing, palpitation. That's not enough for me to say, okay, I want to give the next thing. But it depends. If the Nclex just say, what intervention will I do? Right? It means that they are giving me that option to decide from different intervention for me to do based on the client situation. But when the Nclex say first, right, it means that they know I have a lot of things in my mindset on how to solve SVT, but I need to think about the first thing. Remember I said nursing process. Now this will follow nursing process because we are assessing a patient condition situation, so it's going to be a nursing process based on the first. So now what comes first in the nursing process? Assessment. Then if I look at my 4 option, I'm looking for assessment. Right there, number 4, I am seeing assessment. That would be my answer. You will ask me, why is that my answer? Based on concept. But if you try to use knowledge, maybe you have knowledge about the ECG, the situation, you can look at it and say, okay, A is possible. C, trust me, this particular question, I'm using concept to answer the question. So I will not really say if C and D is possible, because I'm just answering this question based on concept, right? So based on concept, the answer will always be B. Now, if you check your Nclex test plan, the Nclex said in a certain part after client need, the Nclex said the question are written in, okay, they said the Nclex question are written in client need. They're also written in nursing process. This is an example of those kind of questions that are written in nursing process. When you see this kind of question, it's a bonus. Nclex will not just put assessment in just any question. It's not possible. Nclex will not just put assessment in just any question. Immediately, if you see assessment in that particular question and you look at the patient's situation, is not a life-threatening situation, there's no place the Nclex is saying anything concerning life-threatening, trust me, that's the answer B. So this answer is B, guys.